Hepatitis is a word that might sound complicated, but its meaning is quite simple. It means inflammation of the liver. Think of your liver as your body's main filter, a very hard-working organ that cleans your blood, helps with digestion, and stores energy. When the liver becomes inflamed, it can't do its job properly. This inflammation can cause serious health problems if it is not treated. The causes of hepatitis are varied, but most often it is caused by a group of viruses, known specifically as the hepatitis viruses. However, other things like excessive alcohol use, certain toxins, some medications, and even our own immune system attacking the liver can also lead to this condition. Understanding this inflammation is the first step toward protecting your health. The liver is an incredibly resilient organ, often able to repair itself. But when it is constantly inflamed, which we call chronic hepatitis, it can lead to permanent scarring. This scarring is known as cirrhosis. Cirrhosis makes it very difficult for the liver to function and can eventually lead to liver failure or even liver cancer. This is why paying attention to liver health is so critical for your overall well-being. It's not just about avoiding viruses. It's about a lifestyle that supports this vital organ in every way possible, ensuring it can continue its essential work for years to come. Many people with hepatitis do not even know they have it, especially in the early stages. This is because the symptoms can be very mild or feel like a common flu. You might experience fatigue, nausea, stomach pain, or a low-grade fever. Some people might notice their skin or the whites of their eyes turning yellow, a condition called jaundice. Because these signs can be easily overlooked, the virus can quietly damage the liver for many years without anyone realizing it. This silent nature of the disease is what makes it so dangerous and highlights the absolute necessity of awareness and regular medical checkups, particularly if you have risk factors. The global impact of hepatitis is enormous, affecting hundreds of millions of people worldwide. It represents a significant public health challenge because of its potential to cause widespread illness and death. Raising awareness about what hepatitis is, how it spreads, and how it can be prevented is a crucial mission for the medical community. The more people understand the basics of this condition, the better equipped we all are to make informed decisions about our health. This knowledge empowers individuals to seek testing, adopt safer practices, and get the treatment they need before irreversible damage occurs to their liver, protecting not only themselves, but their communities as well. Getting a proper diagnosis for hepatitis is incredibly important. Without a diagnosis, you cannot get the right treatment. Since different types of hepatitis are caused by different viruses and have different outcomes, knowing exactly which one you have is the key to managing the condition effectively. A diagnosis transforms an unknown illness into a manageable health issue with a clear path forward. It allows doctors to create a specific treatment plan designed just for you. This plan can help control the virus, reduce liver inflammation, and prevent more serious complications like cirrhosis or liver cancer from developing later in life. It's about taking control of the situation. The diagnostic process usually begins with a conversation and a physical exam. Your doctor will ask you about your symptoms, your medical history, your lifestyle, and any potential exposures to the hepatitis virus. They will want to know about your travel history, any drug use or sexual history, as these can be risk factors. During the physical exam, your doctor will gently press on your abdomen to check if your liver is enlarged or tender. They will also look for other physical signs, such as jaundice, which is the yellowing of your skin and eyes. This initial step is simple, but provides crucial clues that can point toward a liver problem. The most definitive way to diagnose hepatitis, however, is through blood tests. These tests are powerful tools that can tell us a lot about what is happening inside your body. One set of tests, called liver function tests, measures the levels of certain enzymes and proteins in your blood. When the liver is damaged or inflamed, it releases these enzymes, so high levels can signal a problem. Another type of blood test looks for antigens, which are parts of the virus itself, or antibodies, which are proteins your immune system creates to fight the virus. These specific tests can confirm a hepatitis infection and identify the exact type of virus causing it. In some cases, especially if chronic hepatitis is suspected, your doctor might recommend further imaging or even a liver biopsy. An ultrasound, for example, can create a picture of your liver and show any signs of damage or scarring. A liver biopsy involves taking a very small sample of liver tissue with a thin needle. This tissue is then examined under a microscope to see the extent of the inflammation and scarring. While it might sound intimidating, a biopsy gives doctors the most detailed information about the health of your liver, which is essential for determining the severity of the disease and guiding the most effective long-term treatment strategy. The most common types of viral hepatitis are A, B, and C, and each one is different. Hepatitis A is typically a short-term or acute infection. People usually get hepatitis A by consuming food or water that has been contaminated with the feces of an infected person. This can happen in places with poor sanitation or through close personal contact. While hepatitis A can make you feel very sick for a few weeks or months, it almost never leads to a chronic, long-term infection. Most people who get it recover completely without any lasting liver damage. There is also a very effective and safe vaccine available to prevent hepatitis A infection. Hepatitis B, on the other hand, can be much more serious because it can become a chronic condition. This virus is spread through contact with infected blood, semen, or other body fluids. This means it can be transmitted through sexual contact, sharing needles for drug use, or from an infected mother to her baby during childbirth. While many adults who get hepatitis B will clear the infection on their own, a small percentage, and a much larger percentage of infected infants, will develop a chronic infection. Chronic hepatitis B is a leading cause of liver cirrhosis and liver cancer worldwide, but thankfully, there is also a safe and effective vaccine to prevent it. Hepatitis C is most commonly spread through direct contact with infected blood. In the past, it was often spread through blood transfusions, but now our blood supply is screened very carefully. Today, the most common way people get hepatitis C is by sharing needles or other equipment used to inject drugs. Similar to hepatitis B, hepatitis C can start as an acute infection, but very often becomes chronic. In fact, the majority of people infected with hepatitis C will develop a chronic infection, which can silently damage the liver for decades. This long-term damage makes it a major cause of liver transplants. The good news about hepatitis C is that treatments have advanced dramatically in recent years. New antiviral medications can now cure most cases of hepatitis C in just a few months, with very few side effects. This is a massive breakthrough in medicine. However, there is currently no vaccine to prevent hepatitis C, which makes prevention and early detection even more critical. Knowing the differences between these three types is vital. It helps us understand our risks, know when to get tested, and take the right steps to protect ourselves and others from infection, whether that's through vaccination, safe practices, or seeking out curative treatments. Beyond the more common types, there are also hepatitis D and hepatitis E. Hepatitis D is a unique and particularly serious virus because it can only infect people who are already infected with hepatitis B. You cannot get hepatitis D on your own. It needs the hepatitis B virus to survive and replicate in your body. This is what we call a co-infection or a superinfection. This combination of the two viruses, hepatitis B and D, can lead to a much more severe illness and a faster progression to life-threatening conditions like liver failure and liver cancer compared to having hepatitis B alone. It essentially makes a bad situation much worse. The transmission of hepatitis D is similar to that of hepatitis B. It spreads through contact with infected blood or other bodily fluids, such as through sharing needles or unprotected sexual contact. Because hepatitis D depends entirely on hepatitis B, the best way to prevent it is by preventing hepatitis B in the first place. This makes the hepatitis B vaccine doubly important. If you are vaccinated against hepatitis B, you are also protected from getting hepatitis D. For those already living with chronic hepatitis B, it is crucial to take precautions to avoid exposure to the hepatitis D virus to prevent this dangerous superinfection. Hepatitis E is similar in some ways to hepatitis A. It is most often spread through the fecal-oral route, meaning it is usually contracted by drinking water contaminated with the feces of an infected person. This makes it more common in developing countries with inadequate water sanitation and hygiene standards. In developed countries, hepatitis E can sometimes be spread by eating undercooked pork or venison from an infected animal. For most healthy individuals, hepatitis E causes an acute short-term illness that resolves on its own within a few weeks, and it does not typically lead to a chronic infection. However, hepatitis E can be very dangerous for certain groups of people. For pregnant women, a hepatitis E infection can be particularly severe, leading to a high risk of acute liver failure, which can be fatal for both the mother and the baby. It can also become a chronic infection in people with weakened immune systems, such as organ transplant recipients. Knowing your hepatitis type is the final crucial piece of the puzzle. It determines everything that comes next: the seriousness of the illness, the risk to others, and most importantly, the specific treatment plan that can protect your liver and restore your health for the long term.